As New Mexico sees a surge of coronavirus cases, more cases are also showing up in nursing homes. So are the safety measures put in place to protect the vulnerable populations working? News 13's Gabrielle Burkhart reports.
There's not a way to eliminate every risk because they have caregivers that are from the community.
Katrina Hotrum-Lopez, Secretary for the state's Aging and Long-Term Services Department, explains as COVID-19 spreads through communities, nursing home and long-term care facilities across the state are seeing more cases as well.
It's really attached to the community spread, and that is true because residents, for the most part, aren't leaving those facilities, and so it's coming in from the outside.
According to the Department of Health, more than 70 of New Mexico's nursing home and long-term care facilities reported at least one positive COVID-19 case in the last month. While nursing home deaths from COVID have gone down since May, the state is seeing record numbers of hospitalizations. The state's latest epidemiology report shows more than 17% of patients hospitalized in New Mexico from COVID-19 have died, and more than 50% of people currently hospitalized are between 35 to 64 years old.
So the character of the mortality of this disease is changing. It's driven by high numbers of younger people now.
Nursing home staff in hot spots or counties with higher than 10% test positivity rates must test staff twice a week. Strict safety measures are in place inside facilities, but Hotrum-Lopez is also urging the public to follow safety measures.
It really matters what the public does because you don't know when you're going to come across a person that goes and visits a loved one in a nursing home or actually takes care of one.
Gabrielle Burkhart, KRQE News 13.
New Mexico currently ranks 32nd in the country for the highest rates of COVID-19 cases in nursing homes. Wyoming has the fewest per 1,000 residents. New Jersey is reporting the highest.